Doc, thank you so much for agreeing to be part of this session. Asante sana. I'm really looking forward to having an insightful session when it comes to personal health. Do you have like a PowerPoint presentation or something?
I am the old school type, so
Very
trust
good.
me, I'll make
Bora,
sure that
bora.
everybody gets it.
I think that's very okay. So I'm going to pin you for everyone so that
Yeah,
they can actually get to have a view. So if you're using your smartphone, I think what you can do is you can now pin. You have the ability to view Doc as the only person you want to see. So uh, thank you, Doc. I think you can take it over from there and talk about personal health. Uh,
good.
yeah, the floor is yours.
Thank you so much for this opportunity. I appreciate it. And is there anybody here who is from outside the country? When I say the country, I mean Kenya. Good, good. Okay, all right. So we'll keep it in English, and sometimes when we try and put in some Swahili words, you can spare us a bit, but you can also remind us so that we all move as a team. So thank you so much for all of you who have come on this platform. This is always a conversation. When I talk to people, I always encourage a conversation. So those questions can be raised so that by the end of this talk, we can easily respond to your questions. And we are here courtesy of Elvis. So we're going to make it as interesting as possible. We're going to make sure that you get the information that you require in regards of personal health. So as a way of introduction, my name is Dr. Lewis Muchile Obunde. There are those who know us from TikTok and also from YouTube as Health and Wellness Sport. Health and Wellness Sport. Now, Health and Wellness Sport is basically an institution. I call it an institution because it has so many things that is basically involved in trying to bridge the gap between the general public and healthcare. Okay, healthcare being the healthcare providers, the hospitals, and all this, including the ministries. So that's what we do. We actually uh, help you understand health in a way that is easier for you to digest, because I realized there is a very huge gap between the general public and healthcare providers and even the healthcare system in general. And when you have that bigger gap, it is easier for us to exploit you because you don't understand anything. So if I tell you to simply drink uh, a gallon of water in the morning and the evening, you'll do it faithfully and religiously because you have no idea. Daktari just said. And all of you have this notion that Daktari has said and Daktari's word is final. I am here to tell you most of the times I lean the side of a lifestyle and dietary coach more than I lean the side of a doctor, because I realize there are so many gaps when we are trying to train as both medics, doctors, pharmacists, nutritionists, lab technicians. As we train in the school, I think it's some form of conditioning that actually makes us never to think outside the box. And that is the problem, because you have to step outside of the system for you to see things the right way. And then when you step back, you can ask questions when you're part of that system. And that's what I do. And possibly that's the reason why TikTok people are like following me, because I ask the questions that you have always wanted to ask, but you don't know who to ask and you're afraid. And even if you try to ask them, you don't have a medical background that will actually help you ask them in an appropriate way. And even if you get the answers that you totally need and satisfactorily. So, yes, welcome to this live, and this is about personal health. And I'm going to talk about several things because I have classified personal health into different stuff, and we will enjoy it. We'll talk about it as we go on and see how it takes us. But remember this: I am also a medical practitioner, but I am under an oath. That's the most important part. And this oath has four things. One is beneficence. And when I tell you about these four things, you'll realize that all these four things are for the benefit of the client. I don't call them patients because you're not a patient until you're diagnosed with some disease or stuff. And once I call you a patient, I'm actually telling you I have to write a prescription for you. So this is the point. We have beneficence. So it has to benefit you from just the name beneficence. That oath that I took is for the benefit of my clients. Number two, non-malfeasance, which basically means do not cause any harm to any individual. Number three is respect autonomy. And the last one is justice. I totally base my understanding and my practice on that part, justice and also non-malfeasance. So to me, personal health is a deeper thing than you know. Like most of you eat, when Elvis asked about people eating healthy, everybody was thumbs up, thumbs up. And then when he asked who exercises, there were a lot of thumbs up all through. And it begs for a question. When you exercise, how good are you at it and how well are you doing it? That is one. Do you have a trainer or do you train on your own? Do you rely on YouTube videos to train? And what type of exercises are you being involved in? Because there are people who walk into a gym, you train for 3, 4 months, 6 months, there is no goal achieved. And then now you become a prey to the predators, those gym instructors that will actually make sure that you start taking the steroids, start taking the protein shakes, eating bananas in the gym so that you can gain mass because of the desperation that comes with you thinking you're not adequate enough because you've worked out for 6 months and there's no goal. Number two, when you talk about healthy eating, most of the time somebody tells me I eat healthy. Then I ask them, kindly define for me what eating healthy means. And they tell you I eat a balanced diet. Now, Shoko knew balanced diet is something that was actually created by the food industry. And it was done that to make sure that that plate has a lot of carbohydrates, very minimal protein, and very minimal vegetables. And then it has the unsaturated fats. I will talk about that unsaturated fats as we head on. But it has unsaturated fats, which you call the seed oils or the vegetable oils. So that's what you call a balanced diet. So when you tell me about a balanced diet, you're telling me about eating rice, eating beans and vegetables, and maybe some few pieces of meat, maybe two, because the nutritionist said you have to take 2 pieces of meat anytime you're eating meat. And then you add on a fruit because, of course, a fruit a day keeps a doctor away. That is the notion out here. But mine is that one fruit every day for a whole year will keep me in and closer to you for a whole lifetime because fruits are very harmful, but these are the modern fruits. So again, let's not jump the bridge. Let's start by defining health. What do you think health is? Is there anybody here who understands what health is? If you just do, kindly just give a thumb up. What do you think health is? Do you know what health is? And I will tell you this. Most of you think that health is an absence of disease. And I bet, I can put a bet on this, that most of you still think that health is an absence of disease. That is not true. Disease is lack of ease. Your system is not functioning normally, so that's a disease, and something has to cause that. But health is being in complete accordance with the environment, which means if you walk into an environment that has a different type of smell, maybe a foul smell, or somebody passes by and they have possibly a body lotion or a body perfume that is totally not in line with what you want, that means you're not healthy. Now, you don't have a disease at that moment in time, but since you don't have a disease, but this person who just walked past you has a perfume that is not in line with what you are used to, that becomes a problem. You're unhealthy. If you eat, for example, your food, the plate that has rice, the plate that has beans, and then you call that a balanced diet, you are unhealthy because you just didn't know what you ate. By the way, do you know beans are carbohydrates? Did you know beans are carbohydrates? How many know beans are carbohydrates? Because I've had this debate over and over. Everybody telling me beans are proteins and beans are proteins, and you cannot tell us anything about that. But I say, understand by that, that beans are carbohydrates. Why? Because beans are 65% fiber. If you understand fiber, fiber is a complex carbohydrate. So therefore, beans are totally carbohydrates. So when you eat that rice, and this is the normal life that we lead. Like we wake up in the morning, we take tea that has milk. Now again, did you know that when you boil milk, it becomes a carbohydrate? How many know that when you boil milk, it becomes a carbohydrate? My job is interesting because we keep on finding new things every other day. And you can imagine, people still think when you drink that tea, you've actually taken protein. Milk is a very poor source of protein. That one you can be assured. But even boiling it now makes it even worse. And even that milk that most of you take is pasteurized. Pasteurized basically means that this milk has been passed under 68 degrees C. Basically, it is sterilizing this milk. You sterilize it. Okay, they just put a fancy word on it, calling it pasteurization, that packet milk. It is not, it is sterilized. And remember, milk is designed to have bacteria, to have protein, to have carbohydrates, to have fats, and to have minerals, because milk was designed for babies and calves. I get in problem with that again. Milk was designed for babies and calves. Why was milk designed for babies and calves? Look at nature. There is a reason why you lose milk teeth and you grow the molars and you grow the canines. That is nature. You cannot undo nature. So it designed it that you reach a point that you lose the milk teeth and now milk stops making sense to you at all. And now you had to eat meat because you have the canines. Now you had to eat the fiber because you have the molars and premolars to grind it. And that's how interesting these things are. Yesterday, I had a whole live of about 2 hours talking about the digestion. Like, did you know you cannot take care of yourself? You cannot actually talk about even personal health if your gut has issues. If you're somebody who has gastritis, somebody who has a reflux disease, the one that gives you call it a heartburn. If you're somebody who has malabsorption and malnutrition, malnutrition basically means you're either malnourished, you have low body weight, or you're obese. Those two people happen to be in the same category. So if you have issues with even sleep, you have issues with hormonal imbalances as women, you have issues with erectile dysfunction, because also that is an issue with hormone balance, you are actually treading on the wrong surface, because your body was designed perfectly. It was designed perfectly to just ensure that it strikes a balance all the time. So your body is literally trying always and every day to strike some form of balance. But you need to help this body. You need to work with the body to strike this balance. Now, unfortunately, this balance is brought about by hormones. This balance is brought about by enzymes. This balance is brought about by different, even including microorganisms. Now, all of us are feeding our bodies with very unhealthy foods. For example, we just said in the morning you took tea. You didn't know milk is carbohydrate when you boil it. So you took tea, which has sugar and then has milk. So milk gives you lactose, that is a carbohydrate. And then sugar gives you sucrose and fructose, those are carbohydrates. And then you took bread. Bread is basically wheat, and wheat is a simple carbohydrate and a very toxic product to your gut. When I talk about the gut, I'm talking about the mouth all the way to the anus. Now, you took two smokies or sausages. You forgot that that is processed red meat, and it has something called MSG, monosodium glutamate. That is something that numbs your taste buds so that you cannot taste foods in their appropriate and normal and natural forms or tastes. So now you've taken that. Now you go, you move, you get into your car and you go to work. At work, the government has made it easier for you, or that private institution has made it easier for you. They serve you with tea at 10. Tea at 10. And guess what you do? You're the first one to take that tea. One cup of tea, because by the time it's getting to 9:30, because of what you ate in the morning, you ate all carbohydrates, they caused a spike in blood glucose levels. So you thought it was, hey, I have energy. That was a fake high. So you got a spike in blood glucose. And then the body instructs the pancreas to give you insulin to just lower this glucose down. Unfortunately, insulin is a hypoglycemic agent or hormone. When I say hypoglycemic, I mean hypo for low and then glycemia for glucose. So it takes your blood glucose to a level that is lower than normal. And guess what happens? The body sends you into cravings to bring in new things. Has to bring in new things, because now the body is sensing there's a low energy because there's low glucose in blood. Now I have to send this person into cravings to bring me more food. That's the reason why by 9:30 you're already yawning. You're busy yawning. People are working, because working on an empty stomach is actually perfect. So there are people who are working on an empty stomach in that office of yours. They are busy doing their work perfectly, but you're yawning. You're just wondering, time. What time? Hello, is there somebody? Okay, you're just wondering what time will 10 come in so that I can take my tea. Now you go take tea, and they give you tea plus samosas, or tea and mandazi, or tea and the same bread. Somebody's raising. Benjamin Okumu has raised his hand. Anyway, let's continue. I think Elvis will regulate that. So yeah, so you're taking tea and bread at that time at 10. Another mistake because another carbohydrate. Then at lunchtime, you're headed to take, in your favorite joint, you take rice and beans, or you take chapati and beans, or you take ugali, a big chunk of ugali plus vegetables, and those vegetables have been cooked in those seed oils, the lianto, the renal, the kimbo. And now you're loading your system with all carbohydrates from morning. At this time, you already have a lot of glucose in your system without even knowing. Now, at 4, there's another tea that is coming in, or you'll end up taking a snack. Maybe take some popcorn here, or maybe take some soda here. And then in the evening at around 7, you're headed home to take another ugali and vegetables. And by the way, did you know a larger percentage of vegetables is also fiber, and fiber is carbohydrate? So when I tell you that you can go on a zero carbohydrate diet, that is not possible. When somebody tells you you can go on a zero carbohydrate diet, that is not possible, because those vegetables that we are telling you that are present in the keto diets are actually fiber, and fiber is carbohydrates. So anyway, that aside, so when we do the cumulative amount of carbohydrates that you've eaten in one day, it is so much. Some of you eat even a plate of pudding, fruit pudding, pineapples and avocados and mangoes at lunch hour, and then you say I don't eat lunch, I only do fruit pudding. My friend, that is a whole meal. So when you're talking about healthy eating, talk to me about animal proteins, and this will bring issues with the vegan. And I hope there's a vegan here so that we can clarify this issue. So eat animal proteins in plenty, but make sure these animal proteins are actually regulated. But you cannot regulate it because you don't know how much the body wants. So for you not to overeat protein, what do? You make sure that these meats are fatty. You eat the fatty part. Don't walk into the butcher and tell the butcherman to give you the lean meat. That is a mistake in the syllabus. They will defend that with all they have, because if they defend that with all they have, they make sure that you're part of this of the food industry, and I'll explain how. So when you eat lean meat, chances of overeating that meat is very high. And now remember, the body does not know how to store protein. So what does the body do? The body uses that protein to make amino acid hormones. Hormones like they come from like amino acids like tryptophan is used to form 5-HT, that is serotonin. This is a hormone that actually helps you in regulation of mood. So people who have depression have a very low 5-HT already. You see, instead of those hospitals telling you to just eat red meat, they will tell you not to eat red meat. You end up getting depressed, and now they put you on antidepressants, which will actually give you suicidal thoughts. So please, as a way of agreement, let's agree drugs should be the last option in therapy. Last option. You are not depressed. You are told that you are depressed, and you believed it, and you became. Whatever you believe, you become. Okay, so this is the point. So eat red meat. The body uses those amino acids to make hormones to regulate your system, to give you mood and help you recover from depression. Okay, number 2, the body will use those amino acids to form structural proteins that will be used for your muscle repair and all that. But excess of this protein, the body does not store protein. So excess of this is actually converted to glucose and then converted to fats. Who is this? So excess of it is actually converted to glucose and then fats. So you can grow fat by just eating red meat, which is lean meat. You can even end up getting diabetes just because you eat lean meat, because of the glucose that is coming as a result of storing this protein, because the body does not know how to store protein. Now, another one. Now you're eating this fatty protein. What are you getting in fatty protein? Why do I always insist on fatty protein? Fat are satiety food. So fats cannot allow you by all means to overeat protein. All of you know, if you go and buy that fatty meat and cook it, if you eat it, you'll not overeat it, because fats will make you feel full faster, and then they take a long time before they are digested and absorbed. And that long time is what we need, because we want to give yourself about 6 to 8 hours between meals. So eat fatty protein, because again, these fats are the ones that are responsible for you absorbing fat-soluble vitamins. Number 1 on the fat-soluble vitamins is A. So vitamin A, vitamin B, vitamin E, and vitamin K. These are what we call fat-soluble vitamins. You cannot absorb the fat-soluble vitamins without the fats. So you must eat fatty meats so that you absorb the vitamins that are present in those vegetables. So now start telling me how healthy you're eating. If at all you're still using Rina to cook your vegetables, how will you end up absorbing vitamins from these vegetables? And this is the reason why most people are actually deficient in vitamins, but they don't know until they go to the doctor and they do tests. Now they realize they have deficiency in vitamin D. And instead of your doctor telling you to eat fatty meats, to eat the eggs, the liver, and the green leafy vegetables, your doctor puts you on vitamin D supplements, the vitamin D3 supplements and the calcium carbonate supplements. And did you know that calcium carbonate is actually chalk? Did you know that? So the doctor puts you on vitamin D3 and chalk. And then you end up having all these issues with constipation because calcium salts cause you constipation. Now, this calcium carbonate, the chalk is non-absorbable. So you cannot absorb it. And calcium is one of the metals or one of the minerals that is actually regulated in the body, so strictly regulated in the body, that a very slight increase in blood calcium, that is what we call hypercalcemia. This calcium will end up being deposited on the blood vessels. When it's deposited on the blood vessels, it causes something called calcification of blood vessels. That calcification of blood vessels basically means hardening, and that's where we start getting your hypertension from. And this is the reason why people who are hypertensive are given drugs like nifedipine or amlodipine. These are called calcium channel blockers. They block the absorption of calcium. So are we thinking now? So if your calcium levels are going up, you end up getting hypertension. So we have to give you a drug that blocks the absorption of the calcium. Once you block the absorption of calcium, you recover from blood pressure. But on that blood pressure part, there's one mineral that actually helps you recover from blood pressure without having to use nifedipine, the calcium channel blockers. That mineral is what we call magnesium. And this is the reason why you're told to eat more avocados, more nuts, and use sea salt or Himalayan salt when you are a hypertensive patient. But the system has set you up already. They tell you if you eat salt, salt will cause you hypertension. That is not true. Salt is actually intended to help you balance your blood pressure. Salt that has magnesium is going to intentionally help you reverse calcium toxicity, and therefore your blood vessels become smooth. And then once they become smooth, your blood pressure eases up. Also remember, calcium is a what? Is a constricting element. So when calcium is into the cells constrict. Once they constrict, you have difficulty in breathing because your bronchioles constrict. You have difficulties in your heart because the heart muscles constrict. And when they constrict, they bring you problems. So if you're a gym person, don't ever go for the calcium supplement just because you need heavy bones and strong bones so that you can lift heavier. You will end up having more problems. That is saturated fats. Anyway, what are the best cooking oil? Now that I told you no Rina, no Kimbo, no Kasuku, no Eliando and Chipsy and all that, the best cooking oil has to be ghee. How many of you are using ghee? Or the animal fats generally? How many of you are using animal fats to cook their meals? A good number there already. How many of you are still on the seed oils? How many of you are still on the seed oils? Good. Tallow is part of it. Nancy, I see that. Tallow is there. We have lard, which means pork lard. So the pork fat is there. We have ule kondo, that lamb tail. Every animal fat, even the hump of the camel. So ghee comes from milk, and butter also is good. You can also use cheese for those of you who have access to that. And then you can use tallow, you can use ghee, you can use coconut oil. Coconut oil and avocado oil are the only ones that are not animal fats, but they are the saturated fats. So run away from the unsaturated fats, the seed oils and the vegetable oils, and start using the saturated fats. All the animal fats plus coconut oil and avocado oil. Limit yourself to that. And then consume fatty protein. And I just explained why you should consume fatty protein. And then consume your green leafy vegetables. All of them. Now, don't be lied to that sukuma wiki will cause you acidity. There is nothing like hyperacidity. There's nothing like hyperacidity. In any case, your stomach was designed to be highly acidic. That HCl in that stomach is very necessary because it's there to help you digest protein, the larger protein molecules. And this is where the vegan diets get it wrong, because they tell you that meats will take too much time to be digested and they're not healthy for you. But the reality is there is a reason why you have HCl in the stomach. That HCl can even melt a blade. And it exists there for a reason. Number one, any food that you're eating to your stomach that comes with microorganisms, they are destroyed because they cannot stand that high temp, that high, that low pH, that strongly concentrated acid, including H. pylori. Number two, so brucellosis that is coming with milk. Those who tell me, if I take this product, the dairy product, they might bring me brucellosis. I tell you no. Meat cannot give you brucellosis because you have a strong acid. Simply work on the strength of the acid. You will not suffer from brucellosis. Cholera is there. Typhoid is there. But if you don't take care of your gut, there's a cholera vaccine right now. There is a typhoid vaccine right now. So instead of somebody just telling you to sanitize, maybe practice proper sanitation, not sanitize, proper sanitation, and then eat foods that encourage strength of the acid in the stomach. Somebody is telling you to either take an antacid or take a vaccine. So this acid here is necessary because it protects you from microorganisms that are coming with food and water. That HCl also protects you from the reflux disease. That HCl also helps you digest protein so that you can absorb all the minerals in that protein. That HCl exists to make sure that the population of microorganisms, remember our bodies are just microorganisms. Actually, bacterial cells in our system are more than our normal body cells. So that tells you how important they are in your system. So don't demonize them. And your gut harbors most of them. So that HCl makes sure that in your stomach, only bacteria that can survive under an acidic pH survive there. So if you go ahead and take antacids, if you go ahead and take alcohol, if you go ahead and take possibly more carbohydrates and the sugars, you are actually messing the environment of the stomach. How about olive oil? Caroline, olive oil is unsaturated. Remember, we are using saturated fats. Olive oil is unsaturated. It should only be used for top dressing of salads. Okay, it should not only be used for top dressing of salads. Don't expose it to heat, and that's why it comes in an amber colored bottle. So it cannot be exposed to light or more heat, because if you use, most of you use olive oil to make eggs, but you see you're exposing it to temperature. Now that heat causes something called rancidity. Do you remember rancidity? Basically oxidation. When you oxidize, because the unsaturated fats have double bonds and they are unstable. So when you expose them to light or heat, they oxidize. Once they oxidize, they become very dangerous because they form reactive oxygen species, or the radicals that initiate the process of cancer, that initiate inflammation in your system, and you start getting the chronic conditions like arthritis, hypertension, heart disease, and all that. Okay? So yes, olive oil is a good one, but use olive oil for top dressing of salad. Somebody's asking about Brookside ghee. Brookside ghee, I'm not sure, but simply know this, that healthy, because I use the KCC ghee most of the times. Just know this, that the healthy fats are stored in a metallic container. If you ever see any fat stored in a plastic container, run. It's your time to run. Run away from that. Anything that is actually in a plastic container, specifically foods, run away from it. So ghee from KCC is very good. I also see another one. Which is the other one for ghee? I think it's yeah, there's one for Brookside, the one that has is it a blue color or something? Lato is in plastic container. I saw it, and also another one. Yeah, Lato is in plastic container, so I saw it. And there's also something else that is called vegetable ghee. My friend, ghee comes from milk. Ghee does not come from any vegetable. And I hope this is not Sita Choma, Elvis. I hope this is not on other platforms that I can end up getting in trouble. Because here we want to anika them all through. We want to just say so. So there's a company in Thika. Canola is a seed oil. It actually comes from rep seeds. It's a seed oil. So throw it away. And canola is basically present in literally all processed foods. The major seed oil in the processed foods is canola. And that's a rapeseed oil. So rapeseed oils, canola. Cotton seed oils, sunflower oil, corn oil, and one of the corn oil, the most important one is the lianto. Okay, so throw them away. Change your cooking oil. And listen, it looks very fancy, but just look at it this way. When I'm boiling Irish potatoes and you pass by, you will hardly notice that I'm making or I'm cooking an Irish potato. But wait until I dip that Irish potato into seed oils, into that tray that has isomafuta. you will easily know that this gentleman is making potato chips or the French fries. That is how the food industry did. The food industry knew what you really want and how your psychology works. They start capitalizing on your health when you are a young child. That's the reason why Coca-Cola advertises their products with white and red, very bright colors and emotional colors. That's why Blue Band, Unilever advertises their products with children. So they tell you that when they show it on TV, they show you that this child has grown an inch more than the child who's not using the Blue Band. And then you fall for that. And your child is looking at that advertisement and thinking, oh, okay, so if I use this Blue Band, I will grow faster than others. Now your child starts eating paint. That is just paint. You start loading your child with paint. And those are the seed oils that actually destroy the guts of your child. And now you started getting that from the time you were messed up. Like, listen, we were set up so early. How many of you have used Colgate ever since you were 3 years old? How many of you? Because I want you to protect your gut. Because when you protect your gut from the mouth to the anus, that gut will protect you. Because theories of diseases, look at all those terms. All of us used Colgate from the time we were 3 years, and we still use it up to now. And now, the same company that makes Colgate realized, there's a new motion that people are now starting to use activated charcoal. So what did they do? They ended up making Colgate activated charcoal. How many how many know that product? How many of you are using it? Activated charcoal from Colgate. Your dentist is the one who sets you up, gives you Sensodyne. Did you know Sensodyne comes from a pharmaceutical company that is called GSK, GlaxoSmithKline? It's a pharmaceutical product. So where Bill Gates was in the country, and is one of the people who sits on boards of these bigger companies. He's the person who told us that we should never cut trees, we should never kill animals, only to realize that he's actually making a laboratory that prints meat. He came here and told us not to cut trees, only to realize that he's the one who sits on boards of Colgate that makes activated charcoal Colgate in these products. So where did he get the trees? Where did he get the trees? If at all we are not supposed to cut trees to make charcoal, where did he get the trees to cut to make activated charcoal toothpaste? And toothpaste, specifically Colgate, and all those that have fluoride in them, they cause calcification of the pineal gland. There's a gland that is here that helps you regulate sleep. So most of you are just lacking sleep, getting sleep patterns, very messed up sleep patterns because of what you used from the time you were 3 years old. You take sugar, you use seed oils, you eat wheat products, all that bread, you use Colgate and these chemicals and all that. And now even our president approved GMO foods. And now fertilizer has been subsidized, even though it's just mchanga, it's sand. But it was subsidized in quotes. So fertilizer was brought in. The same fertilizer that cannot be used in Europe was brought in here. Now we are eating GMO, we are eating the fertilizers, and then we're using herbicides. I saw in Meru, people are using herbicides, which is basically glyphosate, to spray miraa. And then you come out of that, they bring those miraa in Nairobi, and you buy that miraa, you eat that miraa, you chew that miraa with soda. So you've eaten glyphosate, a chemical that is carcinogenic. You've eaten the fertilizer, problems. You've now eaten the miraa, another problem because it's a stimulant. And then you've taken it with soda or an energy drink, sugar. How is your 5 years? I can easily predict your 5 years from now. It is a weekend. Most of you are here learning something new. But there's somebody who is in a bar. He's somebody who told you on Friday, like, hey, my friend, wewe unanga starehe, you don't know how to have fun. There's somebody seated in a bar, galloping those estrogens in form of beer. This is somebody's role model, sitting in a bar drinking beer, and beer is highly estrogenic. So the only thing he's getting from that beer is fatness. He comes out from that bar with a lot of fat. And the next thing is he abused somebody. He got so emotional, he cannot handle his emotions. So beer is a problem to the modern generation. Now he has erectile dysfunction and he has to go to the pharmacy to buy Viagra. Story for another day anyway. Let's continue. So diseases hail from two theories. One theory is the DNA theory, and the other one is the germ theory. Now, this germ theory is where the pharmaceutical industry is capitalized. This doc seems to be having. Anyway, I don't have a CR7 mindset as such. I just have Dr. Levy's mindset, and I always question these things. And by the way, the background that I had in this medical practice has actually given me an upper hand to question the same system, because most of us even are afraid to even question the same system. We sit in the same system. We give drugs to patients when we know that these drugs are only treating symptoms. So we focus on treating symptoms instead of treating the cause. And that's where I come in, because my role is complementary and alternative medicine. So what do? I ease the pain and suffering from God's people. When I ease pain and suffering from your life, the glory does not come to me, it goes back to the Creator. And that's why, about the 7 pillars of healthcare, number 1 is believing in a supreme being. You have to believe in a supreme being. So you cannot tell me about health, you cannot tell me about personal health and personal development if you don't believe in a supreme or a supernatural being. If you're an atheist, well done, you still believe in something. You must believe in a supernatural being. And that's where I start my practice from, because I believe in God. And when I do that, it basically means I have to honor the oath that I took. It's called the Hippocratic Oath, which has 4 things, as I mentioned: beneficence, non-maleficence, justice, and respect for autonomy. Most of you know, when you walk into, and forgive me if I'm going overboard, Elvis, but anyway, most of you know, when you walk into a hospital, your doctor asks you a question, habari yako, mzuri. The next is, shida iko wapi? Shida iko wapi? So somebody asked me one day, what if one day that client asks you, hata we daktari, shida yako iko wapi? The next thing, you will get so agitated and you will tell this person, uoni lines zenye nashughulikia, there's a lot of people out here that I need to I need to attend to. So stop wasting my time. You become so angry. But the reality is, why do we view you as the general public as somebody who always has a problem? Like, you cannot just walk into a hospital and consult. You have to be, you must have a disease. Why? But this is our conditioning, because doctors, pharmacists, pharmaceutical technologies, all healthcare providers, including nutritionists, went through a syllabus, the guidelines. Those guidelines were designed to condition a doctor so that they can use that doctor to condition the masses. This is the time you start distrusting your doctor. But when you ask those doctors those questions, it is exciting, because you see it from where you are. You just see it. Now you're wondering, why is he getting upset? So doctors went to school to be conditioned in a certain way. Once you're conditioned in a certain way, they use you to condition others through the guidelines. Now, did you know that nutrition guidelines are actually sponsored by Nestle Company and Coca-Cola Company? So how do you expect nutrition guidelines to help you? Did you know that the treatment guidelines are actually sponsored by the pharmaceutical industries? For example, in Kenya, the diabetes and hypertension treatment guidelines are sponsored by Novartis and Pfizer. Those two. So how do you expect your parent, your relative, or even you to protect yourself or to prevent yourself from getting hypertension, and to prevent your relatives from getting hypertension? How do you expect that, if at all the guidelines for treatment are sponsored by a company or companies that actually produce the drugs for that condition? You can check it out. The acknowledgement part, they say funding was received from Novartis and Pfizer. This is where you start asking questions. Anyway, so diseases hail from 2 theories. One is the germ theory, one is the DNA theory. On this DNA, if you know the structure of DNA, the helix, that structure is basically polysaccharides. Polysaccharides are carbohydrates. So therefore, it's difficult for us to do without carbohydrates, because it's from our DNA. But don't allow those strong people to tell you that because you have sugar in DNA, you need to eat sugar. And then this DNA, this structure of DNA, which has outside part is the polysaccharides, the carbohydrates. The inside part is the amino acids. What are amino acids? So we have protein in our DNA, that is given. And then whatever holds this carbohydrate structure from outside and the amino acids from inside is the minerals, the salts, the vitamins, Those are the things that are present in our DNA. So when we eat that processed food, that fortified food that has no minerals, that has no protein, that basically is refined carbohydrates, we are feeding our bodies with empty calories. The body is struggling to look for nutrients in that processed foods. Nada. So the body keeps on sending you to bring in new food. And that's how you start eating 5 meals a day. And you start growing fat. Because anytime you eat that meal, you raise your blood glucose, you raise your blood insulin, this glucose is pumped into the fat cells. You start growing fat. And then your doctor will sit there and tell you, you're growing fat because you're eating too much eggs. Now you stop eating eggs, but you're still growing fat. Okay? So these are the 7 pillars of health. Number one, of course, believe in a supreme being. You have to believe in something supreme. Number two is air. There is no way you can survive without air. Oxygen is very important. And this basically means don't stay in a stuffed up area. Why? Because there will be a lot of molds. Some of you personally are not like on a personal level. You air your innerwears or undies inside the bathroom and then you put a towel on top of them. Like your boxers take 4 days or 5 days to dry up just because you aired them in the bathroom and you put a towel on top of it. I mean, how do you expect not to have fungal infection and recurrent yeast infection in women? How? You're feeding yeast by that filthy environment. Air your undies in the sun. It is easier that way. You will make it's actually the best part because even those cotton undies, that cotton was plantation was sprayed with chemicals. So when you buy a new cloth, wash it and air it for at least 8 hours outside. What about using a dryer? No problem. Just dry them. Basically, make sure they have no water in them because that is a filthy environment that will encourage yeast growth. And that is part of personal health. How many of you have suffered recurrent yeast infections? And then ladies keep on using yogurt, thinking that yogurt is supposed to replace the bacteria and supposed to clean their vagina. That is a lie. Yogurt is sugar. It is actually pasteurized. That is carbohydrate, the lactose, and then it has sugar. Sugar feeds yeast. So actually, sugar will make your private to even stink even more. This also goes to most of you who are the ladies who eat pineapples when you're expecting your boyfriend to visit you during the weekend. You go ahead and eat pineapple so that your cookie smells nice for your boyfriend. That is fructose. Fructose is sugar. Sugar feeds yeast. How will you survive from this? Let's be honest for once. Let's be honest for once. The best products for you to clean up your vagina is lactic acid. And where do you get lactic acid? You get it from either fermented milk, but that milk should not be boiled. You simply take milk from a cow, sieve it, not from an ATM, the milk ATM. Simply take milk from a cow, a grass-fed cow, sieve it and put it into a gourd for it to ferment, and then drink it without adding sugar. Number two, fermented cabbage. That is what we call sauerkraut. Number three is kefir. Number four is kimchi, if you can get access to kimchi. These are the foods that have bacteria that are very healthy for your cookie. There are also foods that have lactic acid that will balance your. Yes, mursik is perfect, Peter. Mursik is a good one because mursik, as long as it's not boiled, as long as it's not boiled. Okay, good. So we said believe in a supernatural force. Then air is very necessary for you. So definitely, make sure that your house is aerated. You need it because you need to breathe clean air for your cells to function optimally. How about mala daktari? Mala is pasteurized milk. Even if they write on original, run away from it. Even if they write on it non-sweetened, you cannot trust the food industry. They are bigger than you. Run away from it. Number three is sleep. How many of you sleep for at least 6 to 8 hours uninterrupted at night? How many? If you're struggling with sleep, drop the commercial toothpaste. Start using salt. Drop the calcium supplements if you're using any. Start having habits that encourage you to sleep. Don't be on TikTok live until 1 p.m. because sleep is regulated by a cycle, biological clock. If you skip that clock, you'll have to wait for another train. You start altering your sleep patterns. Elvis has always insisted that don't sleep in the same room with your phone. Some of you even have TVs in your bedrooms. What for? Some of you sleep with a laptop near you just because you're a busy person. You're busy, but your job is not your first wealth. Health is your first wealth. Health is your first wealth. So sleep is very important. At least 6 to 8 hours of sleep every night. Number 4, exercise. It is very important. The gym is very important. However, the modern gyms are so effeminate. Modern gyms are designed to just make people weak and sick and depressed because you're there to compare your life with other people. Oh, that gentleman has a big chest. Oh, ladies are comparing their buttocks. That one has a good buttocks because they squat a lot. Squatting cannot build your buttock. Let's start there. You need some knowledge about these things, okay? So now, exercise. The gym was designed to mimic activities that we used to do traditionally that we don't do now. Farming or digging, squatting, pulling and pushing, bending. Now, when you go to the shamba to cultivate those vegetables, in your head, are you thinking I should come out of this shamba with a big chest? Are you? The answer is no. So you don't walk into a gym to go there and come out with a big chest. You're going to the gym to mimic activities that we used to do traditionally that we don't do now because of sedentarism, because of the foods that we eat now, because of the media, because of all this information that we are getting that is actually making sure that, and actually, when I was growing up, we used to plant maize and then the harvest, we take some of those maize, we keep them aside to use them for the next planting season. These guys came in and took those maize away. They brought you the hybrid maize and they brought you the fertilizer. And now they took your life away. Now they brought you the fertilizer that has chemicals that kill your normal soil. Now you have to depend on them for their products. This information that is coming from outside most of the times, simply run away from it. So I know most people use their phones. You're not alone, sir. Most people use their phones until late nights. And you sleep with your phone in your pillow just because you've set an alarm. You have a TV in the bedroom, you sleep with the laptop in the bedroom, you're exposed to ultraviolet radiation through, ladies. When I say ultraviolet radiation, don't confuse me because remember you're at pillar number 4 of health, which is basically exercise. So I was talking about the gym, but I'm distracted a little bit. So when you sleep, ladies, when you go to the salon and you make your nails and then you put it into that blue light, that is high power radiation, UV radiation. That is what you're talking about. That's the problem. The sun can never affect you. If the sun causes skin cancer, all of you will be a problem. And actually, on pillar number 5, add the sun. Enjoy the sun, at least 30 minutes of the sun, 5 days in a week, because we were designed to be 85% of the time outside. But most of us hide in the name that I'm an introvert. And then you sit in the house 24 hours. You simply order Uber Eats. They bring you food from KFC. So you're eating very bad food. The only time you go out is when you're going to put your nails in that thing to get the UV radiation. So rays are actually going to damage your DNA. And when they damage your DNA, do you remember the 2 theories that we mentioned? We said one is the germ theory and the other one is the DNA theory. So I'll tell you about what affects the DNA. Just relax. The germ theory is basically somebody telling you that bacteria are harmful and when they conquer you, they make you sick. But how will they conquer me if my immune system is high? Not possible. So those foods that destroy the DNA are the same foods that lower your immunity. So we'll talk about them as we finish this. So remember, believe in supreme being. Air is very important. Sleep is very important. We added the sun there and then exercise. Those are 5. The other one is rehydration, water and salt. 75% of your body is water. Enjoy water plus salt. Now, on that note, those people who carry bottles of water, 2 liters of bottled water, and then you're sipping and putting it aside, sipping all the time, thinking that you're hydrating, water can actually dehydrate you. You can actually get dehydrated for drinking water. Why? Because water will, as you drink that water, you'll realize you will keep on running to the toilet, and when you urinate, it's a clear fluid, it's a clear urine. That basically tells you you're flushing out electrolytes, the sodium, the potassium. You start having a slight headache. So for you to make sure that you absorb water adequately, either add a pinch of salt in your glass of water. If you have a cup like this, just add a pinch of salt in it and then drink. Or you can put some salt on your tongue, then drink a few, maybe some little water. When that salt goes, now you can drink water. That will ensure that 80% of that water that you drank has been absorbed into the system. Okay, it has been absorbed into the system. So that is adequate rehydration. Salt is also good for your blood vessels. Salt is also good for your blood pressure regulation. Salt is good for your kidney function. Ladies and men who are in their fertility period, salt is good for your fertility because salt plays a very important role in thyroid function. So yes, enjoy salt. And when I'm talking about salt, I'm talking about sodium chloride because that is what we call salt. But additionally, you can use Himalayan pink salt or Celtic salt because these ones have magnesium and have more minerals. So you'll benefit more from that. But if you're not hypertensive, you don't have any issue, using table salt has never been a problem. Even though I know nowadays there are salts that are actually so adulterated, but don't worry about that. Simply make sure you eat salt, whether Himalayan, whether pink salt, whether sea salt or the Celtic salt, enjoy them all, and the table salt. Now, for those who use table salt, for you to capitalize on the iodine that can miss out in table salt, simply eat the seafoods, fish, omena, oysters, enjoy them in plenty. The prawns, they have a lot of iodine and you need it. Then, remember we said we are on pillar number 6, which is now the diet. On diet, we've talked about saturated fats, changing them to animal fats. We've talked about fatty meats and eat all sources of protein, red and white. Red meat does not cause you gout. Red meat does not cause you cancer. What causes you cancer is processed red meats. For heaven's sake, you're told not to eat red meat, but you still eat smokies. I mean, where is the balance? Smokies are the ones that have nitrites and MSG. And MSG and nitrates are the carcinogens, the cancer-causing agents. Enjoy your red meat in plenty. But I know nowadays, cattle are fed on estrogen so that they can grow fat for the business. Same to chicken. How about allergy? Allow me to address that after talking about this allergy. The protein allergies. Good. That's a good question. Thank you. So cattle are now fed with estrogen so that they can grow fat so that they can make more money from this. When cattle grow fat, that is basically estrogen. They are fed on estrogens. Now, this will imbalance your hormones. That chicken that rotates in that screen, that chicken that takes 3 weeks to mature, is the same chicken that you're eating, is the same chicken that is filling your refrigerators at home. You're wasting your time. Ladies, you start growing the beards. Ladies, you start having a lot of issues with emotions. And remember, this same estrogen that is being fed to this chicken is the same estrogen that is in that implant that you're using, that hormonal contraceptives. So if you're on this platform and you have any type of hormonal contraceptives, remove it as early as yesterday. Go and tell that doctor to remove that thing or that nurse. If it is hormonal contraceptives, ladies, do away with it. Birth control is in the hands of men. Men are the ones who carry the seeds. If your man will not ejaculate, you will not get pregnant. Let your man wear a condom. It's that easy. If they cannot wear a condom, one day we will talk about semen retention. They have to retain their semen. And men, ejaculation and orgasm are not the same. They are not the same. Orgasm is the good feeling. Ejaculation is the end result. When you just pour it out, that's ejaculation. That is not the same as orgasm. Apparently, most of you have believed that orgasm and ejaculation are the same thing. So when you're ejaculating, you're almost ejaculating, you hold on to your woman so tightly, and now you're thinking it's the same thing. They're not. When you start listening and paying attention to the sex process or the event, you start understanding there's a difference between that orgasm and then an ejaculation. So you'd rather retain your semen, get the orgasm, but do not ejaculate until you want to get a child. Now, this one topic that men find it so difficult to get. And the reason is because most of the men nowadays, imagine 63% of marriages are sexless. 63. Those guys come out and tell you, marriage is working. 63% of those marriages are sexless. I am an advocate of marriages. I love people getting married. But 63% of these people are not having sex. Why? Because either the woman got bored, either the man is cheating, either the man grew fat, there's so much emotions, the woman is on contraceptive, so their sexual urge has gone down. There are so many factors around this, but diet, exercise, the sun, air, all these play a very important role. But that's another topic. Okay, so we cannot talk about that. So simply know this. So simply know this, that we have diets, we have God, we have air, we have the sun, we have sleep, we have water, and salt. Those are the 7 principles and pillars of your health. Start exercising them. Which one do you think I've not talked about? So that I can make sure that I make it clear to you before I leave this. And before I even finish, let me tell you this. We don't inherit genes. We inherit diets that cause problems. Most of you did not inherit genes. You are not obese because your dad was obese. No, you are obese because you eat foods that your father used to eat. Kindly repeat those pillars. Number 1 is God or a supreme being. Number 2 is air. Oxygen is very important. Number 3 is sleep, 6 to 8 hours of night. Number 4 is the sun, very important, at least 30 minutes of the sun every day. Number 5 is exercise. Go to the gym at least 3 times a week and rest. Actually, you gain more. You gain more when you're resting than when you're working out. When you're working out, you go just to tear the muscles. When you're resting, they repair and then they help you lift more or heavier weights. So you need rest in between your exercises. And then when you're in the gym, prioritize heavy, not basically heavy lifting, but prioritize weight lifting. So the deadlift, the overhead shoulder press, the pull up, the squats, the bend over rows, the bench press, specifically the incline. These are the exercises that you're supposed to basically concentrate on in the gym. If you want to lose weight, if you want to lose fat, if you want to lead a healthy life, go for these 6. Simply go into the gym, warm up, and do these 6 and work out. About 40 to 1 hour is the maximum time you should spend in that gym. Don't go in the gym with the energy drinks. Don't eat anything in the gym. Don't eat pre or post workout meal. Simply when you're doing your meal every day at 4 p.m., do it at 4 p.m., go to the gym at around 8. That's simple. Doc, help me how to manage. I don't know. Where that one disappeared. I wanted to read it. Anyway, I'll still answer it later on. So yeah, have you gotten the pillars, the exercise, and then now, of course, the diet? Okay. Yep. And then another important part is fasting. Fasting is very important because fasting clears out all the crap that you've done. All the crap that you've done. Most of you know you cannot maintain a healthy life for the longest period of time. You will fail at some point. So fasting comes in, a prolonged fast, possibly a 48 or a 72-hour fast once a month. It comes in to clean up your system. And if you can push a 48-hour fast every after 2 weeks, it will clean up your system. It will clean up your cells. There's something called autophagy, which basically cleans up the cells. When you're trying to lose weight, it will clean up the cells so that you don't have the sagging skin. Fasting helps you connect with your spirituality because it's very important. Fasting improves your mental clarity because it produces a hormone that is called BDNF, brain-derived neurotropic factor, which basically replaces your brain cells and your nerve cells. So you need it. So you can do either an intermittent fast of 16:8. That means your first meal of the day comes in at noon and your last meal of the day comes in at around 7:30 in the evening. But in between those 2 meals, no eating, no snacking, because snacking is eating. Simply rehydrate with water and salt, sugarless black coffee, sugarless green tea, or sugarless black tea. Okay, so you have 2 meals a day, and then you have 8 hours between those meals, and now 16 hours of fasting. And then at least those happens for at least 4 days in a week. 3 days push a 1 day a meal, 1 meal a day. So 4 days of 2 meals and 3 days of 1 meal. And then after 2 weeks, you push a 48-hour fast. Possibly start on Friday and end on Sunday because the weekends are when there is more activity. So you might end up lacking the discipline of diets. So you can fast during the weekends. And fasting improves your psychic. Somebody who is fasting, even triggering the emotions is very difficult because fasting lowers estrogen. That's a beauty. That's a beauty. Okay. Now, on to the final step of this one. You can hardly fix your body without fixing your gut. And 98% of diseases hail from a messed up gut, from the mouth to the anus. That tube is very important. It's 8 meters long, but it's the most important tube that you have to protect with all you have. Foods that mess up your gut: seed oils, wheat products, sugar in all forms, including fruits and honey, including stevia. So when you fix your gut, all those conditions start to disappear. For example, you cannot absorb protein, the amino acids, without having a strong HCl because you not tear them down. You'll have protein indigestion and bloating. When you fix the gut, basically you're taking salt and water, you're fasting, and you're eating high protein diets, which are fatty. This is the gut wall. So here is the inside the stomach, this is outside the stomach. Inside the stomach is where you have the HCl and the foods. Outside you have the blood vessels and the nervous system and also the immune system, the lymphatic system. Now, when you eat seed oils, when you eat wheat products, you eat the rice, you eat the processed foods and the sugars, what they do is they cause a perforation in this gut wall. So they open it up a little bit. When they open it up, you expose stomach content to the immune system. Now, this immune system does not recognize stomach content, so it will react. And what you see on that reaction is what you see on the skin. This is for the protein allergies. I hope I'm answering that person who has the protein allergies. So when you eat the egg, those particles of the egg will seep in through this messed up wall, this leaky gut, and they will encounter an immune system. And since the immune system does not recognize them, it will fight them. And that is the result that you will see on your skin as allergies. So therefore, there is no protein allergies. It is basically wheat addiction, sugar addiction, and processed food addiction. So if you drop the eggs, have you fixed the gut? When you drop the meat, have you fixed this gut, this leaky gut? Have you? The answer is no. But when you drop the seed oils, the wheat products, and the sugar that cause this leaky gut, this wall heals. Once it heals, you will enjoy your protein. Therefore, you're blaming eggs for what wheat, sugar, and seed oils cost you. So drop those and you'll enjoy your eggs. Okay? Good. Again, anytime you take an antibiotic, and nowadays, not nowadays, like now it's a flu season. Everybody has a flu somewhere. You might end up catching that flu. Most flus are actually viral conditions, but most of you will end up to the pharmacy and buy azithromycin or amoxicillin. These are antibiotics, so you're treating a viral condition using antibiotics. When you're treating a viral condition using antibiotics, that's the problem, because these antibiotics end up sweeping all the good bacteria in your gut. And now you have to replace that by taking either a probiotic or the fermented cabbage or the smurusik or the kefir. You have to take that after an antibiotic therapy. Let antibiotics last for only 5 days, but don't use antibiotics if you've not ascertained that this flu is a bacterial flu, maybe a sore throat or a cough that is basically productive. Don't use those things. Don't use antibiotics. Simply use ginger, garlic, and lemon pills. The pills, don't use the lemon juice. Use the lemon pills. The pills plus ginger plus garlic as a concoction and drink it in the evening. You will be fine in warm water. Not hot water, warm water. Okay? Good. So yeah, so things that destroy your gut are those wheat products, seed oils, and sugars. We have antibiotics. We have the painkillers that I call NSAIDs, non-steroidal anti-inflammatory drugs, diclofenac, brufen, meloxicam. These that we use for arthritis. Those are the drugs that mess up your gut, and they'll end up giving you more diseases. We have also cortisol drugs. Those people who use drugs for asthma, you know of hydrocortisone, you know of dexamethasone, you know of budesonide, those drugs that are inhalers, and those drugs that are used in rheumatoid arthritis and sometimes in chronic inflammation like colitis. Those are drugs will mess up your gut big time. And then dehydration. Your gut wall is made up of water, mucus. Mucus is 80% to 95% water. So if you don't rehydrate with salt and water, you end up exposing your gut wall to the acid. You end up having ulcers. You end up having malabsorption. You end up having problems with the gut, the leaky gut, the protein indigestion, and the protein allergies. So you have to hydrate before you eat a meal. For example, before you just have your supper, simply take a glass of water plus salt and drink it. That glass will make sure that your gut wall is thickened and now it's ready for digestion. So do that about 30 minutes to a meal. Take about a glass or 2 glasses of water plus salt. And then tell me the results later on. That's how you fix your gut. And then start fasting, at least a gap of 8 hours between a meal, because your gut was designed to eat, digest. After digesting, it has to absorb and then now clean up after 8 hours of digesting. Clean up and rest. When it rests, it needs new food. But most of you are eating every after 3 hours. When do you digest the food? And then you defend that by saying, if I don't eat, I feel I don't have energy. But food takes about 6 to 8 hours before you get the energy from that food. So how is it that you just ate now and the 1 hour later you are so active? But then after that 1 hour, you are busy yawning again. You want more food. So don't ever be lied to that an empty stomach is a sign of hunger. It's not. It's not. Good. So not unless we have some questions here so they can answer and we move. We keep moving. We keep moving. Is there a question for me? Has somebody written on? Let me just see this. Mhm, mhm.
Am I the only one who is not hearing him?
There's somebody who was an issue. Did I just? Are you hearing me, Elvis?
Yeah, you had. I think I had seen you freeze. Ama, it's me on my end.
Oh no, I have no idea. So is
Okay.
there somebody who has a question for me here? If you have even a question for me, I can easily answer that for you. Did you record any
Oh,
question?
okay. I think there. I think there's very many questions. Maybe what we'll
Good.
do. Maybe if you have a question, you can raise your hand. If you have a question, you can raise your hand. Okay. I'm seeing quite a number of hands.
Well,
Uh,
everybody has a problem.
sure, when it comes to health, people, hata mimi
Yeah.
nimeshtuka sana bana. Imebidi nimeenda kitchen yangu kuangalia if I have some of that crap. I
I
think
know.
I'll first start with Stefan Miner. Stefan Miner, you can ask your question.
Can everybody hear me?
Yeah,
Yes,
we
we
can
can
hear
hear
you.
you.
First of all, I have three questions,
Mhm.
but they are short. So, first of all, you spoke earlier about milk, that when you boil milk, it will turn to be carbohydrate. So, I'd like for you to tell us then why is milk usually categorized in proteins? And also, I'd like you to tell us about the milk that, okay, for me, I usually love drinking milk. So, because you have said drinking boiled milk turns to carbohydrate, so tell me which milk I take that is about protein. And the second question is about, may you repeat about the schedule about fasting? And the third of all, actually, thank you.
Pardon? Pardon the third question, please.
The third question, I think it was only two. Two.
Oh, two. Okay. So fasting fat. I did not say that when you boil milk, you turn it into carbohydrate. No. Milk has carbohydrate, right? But milk also has the protein. So remember, milk is a superfood, but for babies and calves. So since it's a superfood, it was designed to feed this calf so that this calf grows to a level that it can start eating grass. Now, when you boil milk, of course, higher temperatures destroy the structure of protein. You know, the denaturization of protein. So they destroy the natural structure of the protein, and now you're only left with the carbohydrate, which is the lactose. That means by the time you're absorbing that milk, you're not absorbing anything else apart from the lactose, which is the carbohydrate. And most of the adults, actually 65% of the population, when you grow and then you lose the milk teeth, you develop an enzyme that is called amylase to help you digest carbohydrates. But the enzyme that is called lactase that helps you digest the milk when you're still a baby diminishes. So most adults don't even have the enzymes that digest milk. That's the reason why when they take that milk, they end up getting bloated. They end up having constipation. And now they blame something else instead of thinking about the milk because they don't have those enzymes that break down lactose. So most adults are actually lactose intolerant. So that's how milk happens to be. And now, if you are a fan of milk, which type of milk do you take in the beginning? Do you just take milk straight from the cow? Or do you take milk that has been pasteurized? Or do you take milk and then boil it? So what is the milk that you love taking?
Boiled, the one which is
Boiled milk,
directly
right?
from animal, then I boil it.
Oh, good. Now, why don't you take it without boiling it?
We were taught that when you take milk directly, you can get typhoid, you can get diseases, right?
Good. That is the exact point. We were told. We were told. We always, every one of us has been told something. But until you get deeper into the matter, you will never get it, bro. Okay? So, milk, when you boil it, you destroy the structure. But this is the point. If milk was that important to adults, then we will still be suckling our mothers. That is one. Number two, human beings are the only species that change the species that they get their milk from. Have you ever seen a calf changing from the cow to come and, and suckle the human being? Have you seen that? That tells you it's already going against nature. Human beings, why don't we continue with the type of milk that we were introduced to? Why do we change the species? It's because of the misinformation that is coming from the food industry that classified milk as protein. The same industry classified beans as protein because their intention was continue taking that milk, and because it has lactose, lactose is a carbohydrate. When you break it down, what is the nutritional value? You getting addicted to that food. And most of you will tell me that I drink milk to get the calcium because milk has calcium. Which milk has calcium? It's a poor source of calcium, specifically the pasteurized milk, poor source of calcium. At least the one that is coming from the cow direct has calcium because of the bone strength in the calf. But this milk is designed for the calf. So why do we take food from the cow? We take away food from the calf because nature wanted the calf to suckle until it can eat grass. But we take food from the tunanyang'anya, we take food from the cow and we take it to be ours. So the only milk that you can take if you want, if at all you're addicted to milk, simply take milk from a cow, do not boil it, take it straight into a gourd and ferment it and take it without adding sugar. But somebody told you that if you take milk that way, you'll get brucellosis. This is a person who did not tell you to drop seed oils, sugar, and alcohol, cigarette smoking, and the foods that mess up your stomach pH. Because I told you when I was starting that this HCl in your stomach exists for a reason. And one of the reasons is to clear every microorganism that is coming with food and water. So don't fear brucellosis, don't fear typhoid, don't fear cholera, because if your gut is fixed, you will not have problems with those organisms. But we only fear because we know what we eat is actually neutralizing the stomach pH. And when you have that neutral pH, we start suffering from problems of indigestion, reflux disease, cholera, typhoid, and brucellosis. So until you fix your gut, you cannot enjoy that fermented milk. Question number two was the fasting schedules. Fasting schedules, we have intermittent fasting and we have prolonged periodic fasts. Now, intermittent fast, both the fasts are important for you, but the goals are different. For the intermittent fast, you're actually trying to give your gut time to rest after digestion and absorption process. So your gut has to rest. That is nature. It has to rest. But most importantly is you want to make sure that your body, since you've eaten and you've absorbed that glucose, you want to make sure that your body utilizes that glucose, not stores it. So every time we eat a carbohydrate, we spike blood glucose. And this blood glucose has to go somewhere because if it goes up in the blood, it's toxic. So it has to go somewhere to be used for activity. And this is in the muscle cells. But we are not as active as we are supposed to be. So we cannot say that we work out so hard than we eat. It's not true. We actually don't even work out. So that food is actually stored in fat cells as fat. So the body is expecting that one day you will fast to burn that and use it as energy. Okay, but most times we don't fast. We eat 3 meals a day. We are not involved in activities, so we don't create that calorie deficit state to start burning fat so that we lose weight, so that we utilize what we stored. And that's the reason why I tell you, you can do an intermittent fast of about 16-8 because that will help you absorb and then rest and then start burning what you stored. Okay, so that's why I told you to avoid morning breakfast, because once you eat supper, you don't need to eat breakfast, because when you eat breakfast, where did that energy that you preserved the energy that you got from the food that you ate at supper time, where did it go to? It's now just converted to fats and stored in fat cells and start growing the weight. So don't eat morning breakfast. Push your morning breakfast all the way to around 12 noon. That has to be your first meal. And then your next meal comes in 6 hours or 8 hours after that. Period. Do that for 4 days in a week, but 3 days in a week, do 1 meal a day. So basically eat today in the evening and then until tomorrow in the evening. 3 days. Then after 2 weeks, push a 48-hour fast. You eat on Friday at 7 p.m. The next meal you eat is on Sunday at 7 p.m. All through, you're just rehydrating with fluids, water, sugarless black coffee, sugarless green tea, sugarless black tea, and that. But how about sugarless wimpy porridge? You don't take porridge when you're fasting. Porridge is eating. You don't absorb porridge. What you absorb is glucose. Okay? Yeah. Good. So, Stefan, have I answered your question?
Yeah. So
Thank you.
about fasting, what
Yes.
if someone takes, let's say, first meal in the morning, tea, let's say tea and sweet potatoes only? Is there any challenge in the health matters or in the diet?
you see when you take tea, this tea has milk and has sugar. That's carbohydrates. And then you take sweet potato. Sweet potato is basically carbohydrate. So you've taken everything carbohydrates. Why don't you just move this meal at noon and eat possibly eggs plus vegetables and an avocado?
In the morning, eggs and avocado.
But you eat in the morning and then you eat at what time?
Only in the morning. Let's say you do 1 week fasting, only taking breakfast, only, not in
You see, there's something called the biological clock. You'd rather eat at lunch or in the evening. Why? There's something called a biological clock, and it relies on hormones. And these hormones are the ones that control you. So we all know that nobody wakes up hungry. We just found people taking morning breakfast and we got accustomed to it. So when you sleep, your body knows that about 8 to 9 hours from now, you'll wake up. So by 4 or 3 a.m. in the morning, the body starts to produce things that are called the counter-regulatory hormones. These are the cortisol to help you fight stress in the incoming day. This is glucagon to help you boost blood sugar. So it will actually convert any sugar that is stored in the liver into glucose so that it powers you and gives you energy all the way to midday. We have a hormone that is called adrenaline. Just in case somebody surprises you, you are quick to run. Just in case somebody comes to you with war, you can either fight or flight. So it's preparing you. And then we have the growth hormone that is involved in growth. For men, we have a hormone that is called testosterone also that gives you an erection every morning when you wake up. So men, if you're here and you don't get an erection when you wake up, start knowing that you're getting to insulin resistance. You have to reverse that. Now, these hormones, their duty is just to pump glucose from the liver into the blood. So by the time you're waking up, you already have a lot of energy to push through the day. So you don't have to eat again. Because if you eat, anything that is stored in the liver will be converted to fat and stored in fat cells. That's why you don't need morning breakfast. Simply wake up, brush your teeth with salt, drink a cup of warm water that either has lemon pills or that has just salt, and move. And then eat at noon, because that's the time when now glucose in your system starts to go down because of the biological clock. And now you can bring in new food. And now you can sit until the next day at noon. It's easier that way, bro. So we don't just fast for fun. We fast because we have to follow the biological clock, and we fast because it's nature that we need to eat and then fast. I think Stefan is
Okay.
satisfied.
Yeah, thank you. Well clarified. Thank
You're
you.
welcome. Who's next? I think we have a lot of hands here. Well,
Next, we can go with Esther Gola. We will not answer all the questions, but we'll just answer a few, Doc, so that because of time, for purposes, for reasons pertaining to time. Esther Agola, you can ask your question.
Okay, thank you, sir. Okay, Doc, I wanted to ask about some days ago. I started having routine of having some water. I started having 4 liters of water per day, and then I felt like whenever I have that much water, I feel like I want to vomit. I feel like I'm having headache. I feel so bad, and then I didn't know what's the problem because someone told me that for the rheumatoids arthritis, I should be drinking a lot of water. So I didn't
wait a minute.
understand what's the problem.
Wait a minute. You said you drink 4 liters of water.
Yes.
Hey, why?
Someone advised me to do that to control the rheumatoid arthritis that I was asking you how I can control it.
My goodness, I get these things all the time. That somebody has advised me, somebody has told me. I read on the internet. Google said this. I saw this on TikTok. I saw this. Listen, there's so much information out here that will actually mess up your psychic. Drinking 4 liters of water every day, when your body loses only 2.5 liters every day through all channels, what are you doing? You end up getting dehydrated because you'll flush out electrolytes from your system. You'll end up even getting worse because when you flush out that electrolyte, the sodium, water will follow. Now you'll end up having very limited amounts of synovial fluids. Therefore, your joints will even go worse. So are you diagnosed of rheumatoid arthritis?
Yeah, just recently, and I did not even start taking the drugs. I didn't start with the drugs. I wanted to manage them that by dieting and those sorts of things.
So tell me something about your diet. What do you
Okay,
eat? How many meals do you eat in a day?
After I was told that I had it, I started having 1 meal per day.
Okay. What time?
Yeah, I cut off on coffee. I used to have a lot of coffee, and I've cut off on coffee. I've cut off on a lot of things
Let me ask you a question.
that I was
Before, when
told,
you
but
went to hospital, before that diagnosis, when you went to hospital, what was the reason that took you to hospital?
I was having swollen feet, and then unasikia ni kama inachoma choma
Kwa joints ama kwa feet huko chini?
kwa feet, and yes, kwa
Then
feet.
you were told this rheumatoid arthritis.
The doctor mwenye alinipima aliniambia.
What types of tests did they run on you? Did they do the rheumatoid factor?
No,
So they did not do any. What tests did they do to you?
they just took blood, they tested, and they told me about that.
Listen, your
Ati ndio
first
maana
ndio maana
wakaniambia ndio maana miguu nasikia ni kama inachomeka.
your first immunity starts from the head. So don't let them make you believe that you have rheumatoid arthritis. Rheumatoid arthritis is an autoimmune. When you hear the word autoimmune, it's basically your immune system starting to target your own cells. And your immune system cannot just wake up one day and start to target your immune cell, your body cells. There's something that caused that immune system to start overreacting. And most of the times is the adrenal gland. There's a gland that is on top of your kidneys that produces cortisol. Cortisol is a hormone that helps you fight stress. And this hormone also makes sure that it reminds your immune system not to overreact. Not to overreact. So if your adrenal gland is a messed up gland, of course, rheumatoid arthritis will be there. Of course, asthma will be there. Inflammatory bowel syndrome will be there. Colitis will be there. And psoriasis. All the autoimmune conditions will start targeting you. So simply do this. I'm so glad that you're already on 1 meal a day. But this 1 meal a day, simply take it on basically very low carbohydrate. And what that carbohydrate will be is the vegetables. The vegetables.
Yeah.
Now, do you enjoy fruits?
Yes, I stopped that too. I stopped on fruits too because I was told it has they have a lot of calories.
When did you stop?
Yes.
When did you stop?
Early this year, January. Yeah.
Is there any improvement?
Not really, nothing. It's worsening.
What is your cooking oil?
Canola, but I had changed to ghee and butter.
When did you change?
That the same January.
Really? You know the best thing you can do, to be honest with me. Do you eat any wheat products?
Yes.
Chapati, mandazi, bread, do you do that?
Yes, I eat bread. I use a lot of bread, in fact.
Bread. And how about sugar?
Yeah, sugar. I use sugar.
Okay. And you said you only do 1 meal a day from January.
Yes.
Do you eat red meat?
Yes, a lot of red meat.
You eat the fatty part or the lean part?
The lean part.
Why? So now start eating the fatty part, okay?
Okay.
Now, no excuses. Drop the sugar. I know how addictive it is, but drop the sugar in all forms, including fruits and honey. So there's no sugar substitute. Drop the sugar totally.
Okay.
Drop that bread and the wheat products, spaghetti, pasta, injera, chapati, mandazi, bread, either brown or white. Drop them totally. Then change that cooking oil to basically ghee or tallow. Okay?
Yes.
Then simply push yourself to a 36-hour fast every weekday or every weekend. A 36-hour fast at maximum. Make sure that it happens every week.
Okay.
And tell us about rheumatoid arthritis in future. This is you fixing your adrenal glands. This is you fixing your gut, and therefore no autoimmune. Simply do that. And be strict with yourself, be disciplined with yourself. If you can, make sure that you have a team around you that when you're fasting, you tell them, you inform them, so that when you go to eat, they tell you, hey, You said you're fasting this weekend.
Okay.
Don't use the
Okay.
drugs until we are unable to handle that situation.
Okay. Thank you. Thank you so much.
All right.
And,
All
and,
right.
and Elvis, just before she drops down, I would like her not to take the 4 liters of water. Simply take water when you're thirsty and just add a pinch of salt. You don't need 4 liters of water every day. You don't need it. You'll end up being dehydrated. So take water when you're thirsty and add a pinch of salt. Make sure you add salt in your drinking water. Perfect healthcare.
All right. We're only going to be taking 2 final questions from Karen Karanja and Anduku. So Karen, go ahead.
Thank you, Elvis. Hi, Elvis, and hi, Doc.
Hi,
How are
Karen.
you?
Well, I've learned a lot. Hadi nasikia ni kama what we were taught was in vain.
Too much
So,
for 2 hours. Yeah.
actually, there's a lot to learn. I hope we'll have another session with you.
Possibly.
So, for me, I started going to the gym like 3 weeks ago.
Okay.
Yeah, 2 weeks ago. And I also like minimized on my meal taking to 1 or 2 meals. So, according to the time and all that, I usually go in the evening. So when I eat maybe at 12 or 1,
Yeah.
when I go at the gym at maybe 4, like that strength won't be a lot. So how do I go about that? Like, is it right to eat earlier and also go to the gym later?
Yeah.
And according to eating or even intermittent fasting, how should also one go about the timings, the best time to really focus on, and the best meals to eat? Because I've realized that we can have a lot of carbohydrates that we are not aware of. So how can one go about that? And also about the meal taking for a baby who is like around 2 years and so, taking milk from the cow, is it advisable for a kid to take a lot of milk from a cow?
Good. One thing that I have to make clear here is, guys, I have a YouTube channel that is called Health and Wellness Sport. And on that YouTube channel, there's a video that I've done that is actually labeled Diet Plan. This video talks to you about every single food that you need to eat and you need to neglect. It breaks it down. It's a very short, a very good video that actually will guide you to make your diet plan. So about the foods that you're supposed to eat, I already mentioned them when I was talking about the fatty meats, all the protein, animal protein, red and white, the vegetables, and the only fruit has to be the avocado. So drop the fruits and then rehydrate. But that video will explain a lot of things to you because of time. So let me tell you this. When you said, should I eat early and then go to the gym later? The reality is, of course, energy does not come from the food that you just ate. Remember, if you eat food now, you need about 6 to 8 hours to get energy from that food. Okay? So, so if you tell me that I ate 3 hours ago and I went to the gym and I felt no energy, that is a lie because it's in your mind. It's a mindset. Hunger is a mindset. It's not an empty stomach. Energy comes from the fat cells and energy comes from the mitochondria. That's the energy mechanism of the cell. So it comes from the fat cells. So when you're in the gym, when you start lifting, you will burn the glucose in your blood, and then the liver will give you glycogen after about 20 minutes to about an hour. And then after that, your body turns, and imagine after an hour, you're already out of the gym. But if you're somebody who trains more than an hour, the body starts to burn the fat to give you energy. And the energy that comes from fat cells is what we call ketone bodies. Ketone bodies are the best energy sources of your system, but they have to be, they will come out when you start burning, when you've burnt all the other energies, the glucose in blood, the glycogen in the liver, in the muscles, and now you start turning to the fat cells to burn ketone bodies. And remember this, 1 gram of ketone bodies or 1 molecule of ketone bodies will give you 9 kilocalories of energy, as compared to 1 gram of carbohydrates that gives you 4 kilocalories. So you already see burning the fat gives you double the energy. So there's no way you can go into low energy. It's just a mindset. And you want to eat because the food addiction that comes with food Basically, it's telling you, hey, you have low glucose, you need to eat for you to go to the gym. And then the information that is around you that everybody tells you, you need to eat when you lift heavy, is a lie. Actually, fasted exercises are the best because remember, in the gym, you're targeting two things. One is something that we call mammalian target of rapamycin. That is the mTOR. Don't cram it. Number two, we have something that is called autophagy. So when you're lifting heavy, you're tearing your muscles, and then you go back and eat your protein diet. That is what we call the mTOR. You benefit from it. And then number two is when you're in the gym and you're fasting, you have attained autophagy. Your cells are cleaning, your skin is becoming glowing, and then you start burning fat to get energy. So fasted exercises are the best. You will not faint in that gym. Enjoy the gym when you're fasted. And that's the reason why training in the morning is the best exercise, because you're on an empty stomach and you're burning the energy, you're burning the fats to give you the energy. So don't worry about eating and going to the gym. It will be a waste of your energy. And then don't also worry about going to the gym and coming and eating so much food, because you went to the gym to create a caloric deficit state so that you burn fat. But when you come back home, like the ugali man, and you eat a lot of ugali, you have actually doubled the energy that you burnt in the gym. So you did zero work. So don't walk one step ahead and three backwards. Don't.
All right. All right. Thanks, Doc, for that. I think we'll take the final question from Ann Duku. Ann, you can go ahead.
Hello, good evening, Elvis and
How
Lewis.
are you?
Hi.
Good.
Good evening.
I'm fine. Yeah, I'm so happy and glad that I've attended this session. Though I've been following you, Dr. Lewis. I'm very active on YouTube than TikTok.
I know you and
Uh,
Duku. I think I recognize you.
yeah, thank you so much. I appreciate your work and what you're doing to the community and keep it up.
Yeah, thank you.
Yeah, yeah. Now I have a couple of questions. Let me just say, if you are able to answer, fine. If you're not able to answer all of them, fine as well. First one, I want to ask. I attended one of your lives, and you mentioned of sleeping on the floor, and I did get it right. Do you mind shedding some light on that? I didn't get that point. And then
Okay.
the next one, yeah. The next one is how to use the charcoal. Do you blend the charcoal or how do you use it for brushing?
Okay.
Yeah, then the next one is about the gym issue. Like currently I'm doing skipping.
Mhm.
Um, I don't know whether it's a must I attend the gym. What I'm doing is okay. I started this last month. Okay, I've been doing some exercises in the house, but I've not been that active. But at least last month, I started since last month. I've been doing skipping for like 30 minutes and
Yeah.
some aerobics for 10 minutes. So collectively for 40 minutes. That is the home workouts. I don't attend gyms. So I don't know how effective is that about the rope skipping.
Yeah.
And then the other one is um, about the meal, this one meal in a day.
Mm.
I can say this one has been working for me, although I don't know whether the time I do is the correct one. This is my second
What
month
time?
now doing one meal, and
Mhm.
now I have no specific time of doing that. But mostly, I do that between 1 and 2, mostly.
Okay.
Between 1 and 2 years. That is when I mostly do my meal, and once
Yeah.
I do it once a day. And then the other one is about diabetes. I
Yeah.
have relatives, so many of them with diabetes, and I want to talk about this one. I have a close relative who is taking this medicine, diapride 2. I don't know how to spell it or to pronounce it. Diapride
Mhm.
2. Then
Mhm.
glypitas 50 over 100. I don't know what that means.
Glipitas.
So I don't know glypitas or galitas. I don't know. Yeah, I don't know what type of diabetes she has, but she
Mhm.
told me it depends on when you got the diabetes. That is how the medication is issued. Now I've been preaching this since I came about your channel, and I've been preaching to so many, but most of the people are ignoring and they arguing. Like this one argued, we kind of quarreled actually. She told me that she is learning from the doctor. She has doctors also, and she has books from doctors, and she's getting from doctors as well. So I stopped preaching. That is so sorry. There's an echo. I don't know. So she argued that if she doesn't take the medicine, what is the issue and what is the agenda? Because if she fails to take the medicine, she starts the draws, is it drowsiness? Yeah, she gets drowsiness. Then about the eating, she cannot do without eating. I'm saying that because I'm in the house, but for her, she's working. So she leaves in the morning. She takes some muji for energy, and then break time, there's that thing you're saying they are given the tea or whatever. So she tried one day and she was almost falling down because of failing to eat. So that is not helping at all. She keeps the medicine away due to this might be a problem, another problem to her health. So I don't know how to help such people because for me, I can say I'm benefiting. Though I am, let me confess to you first, I am a baker, but she came to my light when I was still in the profession. So I'm still looking how to balance the issue. But personally, I've adapted to your issues of cooking well, the consumption of wheat and sugar. I won't say that I've done it 100%, but I'm somewhere along the way. I've done it minimalized. So I don't
Yeah.
know. That
Oh,
is what
good.
I can say.
I think Elvis knew that you will be the last person because these questions are actually covering a lot of things that we have talked about, and they're actually going to change people in this session's lives in general, including their relatives. So let's start
Mm-hmm.
with number one, that sleeping on the ground and that and stuff. This is what we call grounding or earthing. This is the same thing that happens when you walk barefoot at least once in a week. Now, our bodies are full of toxins and radicals because of the foods that we eat from the processed the industries, because of the seed oils that are totally oxidized and we still cook them. So we are full of toxin. We're just a ticking bomb, just waiting to burst. And when you see health conditions like diabetes and hypertension coming up, when you're diagnosed of those diseases, it is actually just a sign that your system is actually doing so bad because of what you're putting in your mouth. We are what we eat. So stick to that. Now, sleeping on the floor does not necessarily meaning you can sleep on a bare floor. No, you can put like a 4-inch mattress on the floor and sleep on the floor without a pillow. Remember this, anytime you bend, because your spine is like this. So anytime you bend, you open up your spine and air gets in. Now this air never goes out. This is how it behaves. The spine behaves like these knuckles. So when that air is trapped there, all the back pains start coming up. You have a lot of pressure being exerted on nerves because the spine carries or harbors the nerves. So you start having a lot of pressure being exerted on these nerves. For you to ease that pressure, you need to straighten your spine. And by straightening your spine, you need to just sleep on the floor and enjoy that moment. Now, you will also release toxin to the surface and your body feels so good. This also happens when you walk barefoot. Do you know why people go to the coast every time? And then they come back saying they are so rejuvenated, the coast was awesome. But they simply go on the beach and walk barefoot on the sand and they enjoy the sea, they connect with nature, and nature takes out all the problems from them, all the toxins from them because the earth is negatively charged and your body, because of the radicals that you're developing, you start getting a positive charge. Once you ease that, you start having very good sleep, you start having very good mental clarity, you start having ease in those joint pains and the back pains. So sleeping on the floor is very necessary, at least 1 or 2 days in a week. It's very important. Okay. Number
Thank
two,
you.
charcoal, how do you make it? Simply grind the charcoal and use it. Our forefathers, our core shamba, they were not so stupid. They used to use this charcoal. They just grind it on a stone to a smooth level, and then they use it to brush their teeth using that miswak or that stick. So you can use the same. You can also buy in the pharmacies activated charcoal. But that activated charcoal must have only one ingredient, the charcoal itself, which is activated and passed through CO2. That's the only thing that you need to do. If you can't get that, simply make your life simpler by using salt. You can also use either bicarbonate of soda, you dilute it and then use it to brush your teeth, period. Question number 3, skipping a rope in the gym. Now, goals are different, but remember this, exercise and the gym, they only play about 15% of your health goals. 15%. 85% is actually played in your kitchen. So therefore, there are people who will get healthy without having to go to the gym. Yes. But the reason why we go to the gym, remember, is we want to mimic the activities that we used to do traditionally that we don't do now. For example, if you skip a rope, what activity are you mimicking in your traditional years? Is there any activity you're mimicking?
No.
There's none. So you're doing it for the fancy part of it. Yes, you'll burn some fat, but I would actually recommend you do a walk. A walk is a full body exercise instead of skipping a rope, because when you skip a rope, you're actually telling your body, yes, I'll burn fat. Yes, I'll burn fat. No, you start burning fat, yes. But it reaches a point when your body has adapted. Now, however much you skip, even if you do 5,000 skips every single day, your body has adapted. What it just does is it makes sure that you spend less energy while skipping that rope so that it doesn't burn more energy. So you'll start, yes, by losing weight, about 2 kgs or so, but then you stagnate. Once you stagnate, what next? This is the same concept that people go to the gym and run on a treadmill for a lifetime. They never lose a weight, a kg. So simply make sure that you go and lift. If you want to go to the gym, enroll to a gym and go and lift. Do the deadlift, do the shoulder press, overhead shoulder press, do the squats, do the chest, the bench press incline, do the pull-ups, because most of you cannot even lift themselves. Do the pull-up, and you can also add on the bend over rows. These are the 6 exercises that will actually burn you fat and help you tighten your skin, tighten your muscles, and achieve the health goals that you want. But skipping a rope is temporary. Next, 1 meal a day at
Thank
what
you.
time? You're doing it at the good time at 1 to 2 p.m. No problem, because at this moment in time, your hormones are going down, your insulin is going down. So it's the good time to feed. Don't just feed in the morning window. Simply feed in the afternoon or the evening window. It's okay. But you need disciplines of diet and eating. Make sure that when you're eating at this time, make it consistent, because your body is a body that learns or adapts habits. When the body adapts these habits, make sure that these habits are predictable and they are workable with. You can work with those habits. People who go to the field, you cannot put them on one type of scheme, because today they eat at 6, tomorrow they're eating at 4. Now that's unpredictability of diet. But I know if you're aiming to achieve healthy goals, you can always make a bold stand and you remain with that bold stand. All of us have choices, and choices have consequences, either positive or negative. It's your role to choose the choices that will build you up. Number 5 is about diabetes, which is the largest one. So diabetes, we talked about your relative having to use these 2 types of drugs. I want you to know this. You are not Jesus Christ. You're not here to save. You see, I only come in between healthcare and general public to make sure that you understand healthcare. That doesn't mean I have to pull people's neck into my business. If you're leading a healthy life and it's working for you, health is your personal journey, is your personal choice. Work with that decision. Those who want to follow suit will see how you're behaving, how your body is reacting, and they will follow suit. Yeah. Those who don't want to follow suit, let them be. Those who have syllabuses and guidelines and books, and they're using those books, but they have never recovered from diabetes, they are still on this medication, they are not thinking. Do not force them to think. Simply work yourself out and let them see that. Once they see that, they become. And now, diabetes is a personal disease. Okay, it's a personal disease. You eat yourself to diabetes, you eat yourself to hypertension. So nobody will eat you out of diabetes. You have to eat yourself out of diabetes. You can only advise, but don't make decisions, don't push them. Okay? Because remember, this is not a physical battle, it's also a spiritual battle. So somebody who doesn't accept your gospel is because, of course, they're actually suspecting that, wewe umejaribu tu hii, unataka kutuambia hii. You think now you've read a book, you want to tell us so much about this. I've heard doctors doing my reviews. Who do you think you are? That is what I experienced when I was starting. Everybody was talking so negative about what I was posting. I post a video and everybody talks negative about it. I didn't care. I kept on pushing because I knew this was the right information, and those who take it, they use it for the better. But imagine me trying to follow you into your inbox to make sure that I convince you to eat healthy foods. It's none of my business. Mine is to tell you this is you to follow or not to follow. Shida ni yako. Diabetes ni wewe umebeba. It's not me, okay? So stop follow. As long as you've advised them and you've told them this is the right thing to do, try this one out, because the fear inaanzanga mali. You tell somebody, try. And then they're like, why would I try that? If I drop my drugs, I'll end up fainting. If I drop my drugs, my blood sugar will go up. The reason why people who are diabetic take diabetic drugs is because they want to live the same life. And this is ignorance. Doing the same things that you used to do, but expecting different results. It's not possible. Diabetes drugs treat the symptoms of diabetes while they let the disease establish itself. They never treat the disease. Medical syllabus and the guidelines, the modern medicine is focused on treating symptoms and symptom management. It doesn't treat any cause. It doesn't help you prevent the diseases. So if somebody's taking drugs, well done, let them take the drug. If they want dietary modification, because remember, dietary diseases, diabetes, hypertension, cancer, heart disease, stroke, and all those dietary conditions, they can only be changed through fixing the kitchen and not popping a pill. Good. Hey, what else? What else were we supposed to talk about? Too much eating. You say they eat too much. You see, this relative of yours is taking a drug that is called diapride. Diapride is actually glibeniclamide. It's actually a drug in the group of drugs that are called sulfonylureas. These are drugs that take you into hypoglycemia. So when they take you into hypoglycemia, your body sends you to craving to eat more. So basically, this acts the same way as insulin. People who are on insulin therapy, they are always hungry. Who are obese are always hungry. So you're thinking this person is fat. He's supposed not to eat too much because he already has enough. But this is some person who has more hunger than somebody who is lean because of their insulin levels. So diabetes is a hormone disease, and these hormones can only be regulated by fixing the kitchen. So your relative should drop all forms of carbohydrates, including the complex carbohydrates. Simply go on fatty meats, simply go on vegetables, and an avocado as their only fruit, and then rehydrate with salt and water. 2 meals a day at maximum, no snacking in between. Hydrate with salt and water, have good sleep, enjoy the sun, and make your life active. At least 5,000 steps every evening of just walking. They will burn the fat, they will burn the glucose. Because remember, diabetes is not high blood sugars. No, that is a symptom of diabetes. That is hyperglycemia. So what your relative is treating is the hyperglycemia, which is a symptom. Diabetes is what is stored in the cells. The glucose that is stored in cells as fat, the glucose that is stored in the liver as glycogen. And for you to burn that, one, you have to stop eating the carbohydrates, and then number two, you have to fast so that have a gap between your meals so that you start burning what you've stored. And that's how you recover from diabetes. Hope I've done justice to you.
Thank you so much, Daktari. Your guest experts are up in one. I'm so
You are
glad.
welcome.
Yeah.
I think we should all give Dr. Lewis a round of applause. Huh? We should all give Dr. Lewis a round of applause. The information I think we've gotten today is information that most people have not gotten. So ideally now you get to understand why he was the best TikToker for me in 2023. And I think 2024 bado ni yeye up to this point because issues pertaining to personal health, these ones we don't have to take, we don't take for granted. Believe me, if you're not healthy, you cannot be able to actually even perform, even when it comes to work. You cannot even sit down and learn a skill. Hutawahi kaa keti chini and improve your life. Why? Because you're unhealthy. So for everyone who's gotten information about what Doc has said, practice it. The good thing about what he talks about is that your health begins with, first of all, watching what you put in your stomach, or basically your gut. So watch your kitchen. And the information was very clear. I'm hoping everyone has been able to grasp it. All I can say is I think, Doc, you've really actually brought the point home. And actually, let me say, that was a 5-star presentation on what you've talked about. I just want to personally extend a form of gratitude to you. Now, I don't think our sessions will end there. So for those, I'm having a boot camp on graphic design, and I want to personally invite you every month for a session on personal health to speak to the participants. In as much as we are learning skills, you cannot practice what you do if you're unhealthy. So first things first is that I'm ready to sign an agreement with you to actually bring you every month at a certain fee. We bring you in, you charge an amount of money, and you speak to guys, especially on a specific topic. What you really talked about is information that should be out there. We have parents who are diabetic, but they don't know that it's treatable. They've only been, brainwashed by mainstream media and, culprits who are in the pharmaceutical industry. All I can say, Doc, is thank you so much. The fact that you're putting out information out here to save lives is more than impressive. And I just want to allow you to end the session. You can actually share your contacts, I think, but people have to know that it's not free consultation. People have to pay for it. Yeah. Yeah. So I think you can share your contacts and basically talk about what you do and just end the session for us. Thank you, Daktari. Thank
Hey
you so
man,
much.
thank you.
Thank you.
Hey man, thank you for those
Mm.
kind words, brother. I was actually surprised to see you ranking me as the top TikToker in 2023. I used to follow you like literally, and of course, I even saw the scandal that people just got in and everybody trying to bring negative hype.
Mm.
This microphone here. So,
Eh, we cannot hear you well. Unapotea kidogo.
kuna mtu amenini? Ah, good. So yeah,
Okay.
so I appreciate because I've been your follower and it actually excited me to see that unatambua kazi yangu kabisa. So thank you so much. And
Actually,
apparently, yes.
actually, I stopped using toothpaste when I saw one video you made, and I started using salt. Toka hiyo days sijai tumia toothpaste tena.
Bro, do you know how
Mm.
weird it is that
Mm.
people just receive this and then when you try salt, you don't wake up with a filthy mouth. So for those of you who like kissing in the morning, this is your
Mm.
chance to try it this night. You will wake up with no filthy mouth. Colgate and those commercial toothpaste are the ones that make you have that filthy mouth. And those commercial mouth, are they called mouthwashes? See,
Yes.
Listerine, please drop those things totally. They destroy your gut, your gut pH and your mouth pH, and they destroy the mouth microorganism and microbiome. They start giving you that filthy thing that you wake up in the morning and you brush your teeth, you start unatema kitu ingine mzito kama mucus. It is a waste of your time. So
True.
anyway, thank you so much for today. And I've seen a lot of your people subscribing to my channel through that video. I just appreciate that, and I hope that God can bless you and open up your doors to even better. Now, I practice my services in Marsabit County, specifically Moyale. So let me reveal where I live nowadays. So I'm in Moyale. So it gets hard for you to get to me on a personal level, but I am literally always in Nairobi the last 2 weeks of the month because we have our offices in Lavington, and that's where we do our online consultations and physical consultations in those 2 weeks. So you can easily use the contact that is the office contact, which is 0707 and then 074722. I'll repeat that, 0707 074722. That is my office contact. You'll get an experience with us. Normally, I tell my people it's not a consultation. When you pay and you get there, it is always a conversation. We work with what you have, and then we work with what I have, and then we get a holistic approach to healthcare. But don't come to me hoping that I'll give you medicines, because to me, medicines are the last option in healthcare. So come to me expecting that I'll help you ease the pain and the burden of that prescription. Okay, so when you come to me, I give you a holistic approach. That's why I told you when I was starting this that at some point I have shifted from being a doctor to a lifestyle coach and a dietary coach, because I believe that diets 85% of what we are growing through. If you're leading a healthy life, is basically your kitchen. If your child is fat, it's because the kitchen is fat. If you're going through diabetes, hypertension, chronic conditions, is because your kitchen is going through the same conditions. So you are what you eat, and when you eat clean, you become clean. And all of us want to get to 100 years without losing memory, without losing eyesight and the ears. And health is very expensive, my friend. Sometimes I see people who come to the hospital and you have worked for 30 years to make sure that you are financially stable. And within 2 weeks, did you see what COVID did to people? A very fake disease, but it was publicized in the media and just came out and wiped off all your savings in a week or a month. You've done that for 5 years and then poop, you're zero. So please take care of your health. It's a personal journey. Walk it alone. You don't need friends to walk on a healthy journey. But I always say this, if I see 5 of your friends being fat, of course you're the 6th person. So therefore choose people who want to walk with your journey. And as I finish this, there's something here. There's this book that I would like most people to read. It's called Choices Have Consequences by Dr. Michael Wamai. It's just a Kenyan writer, so promote those Kenyan writers. And he says something that is very interesting before I end this. So that is my office contact. Use it for consultation, both online and physical. We'll be in Nairobi from Wednesday all the way to 26th. So you can pop in and have a conversation with us. We'll appreciate that. On my YouTube channel, Health and Wellness Sport, we drop videos literally every day, and they are very educative. I also have a Telegram channel that is called Health and Wellness Sport. Simply join in and let's have those conversations there. Okay, we encourage each other, and that Telegram channel acts as a support group, and it's very important that you join in. So listen to this as we finish this. Where you end up in life is not determined by where you start. It is what you choose, the word is choose, to do with your potential that shapes what you want to be. There are two things that will make your dreams come true. Number one is your choices. But number two is your commitment to those choices. So you don't just make a choice and then sit back. You have the choice to make, and then you have to stick or commit to that choice. The commitment is the problem, because most of you have New Year resolutions, but you never stick to them. So these are the choices that will make your life amazing. Number one, be kind to everyone, even those who don't deserve it. But two, smile at every challenge, because there is a divine gift in every challenge. Don't worry about too many things. Thoughts are evil because they are what people put in our heads. Number three, embrace positive change, because if you resist any type of change, it will only yield frustrations. Most of you are depressed because of resisting change, and embrace the change. Number four, always take responsibility, because when you blame, you give away your power. Hey, listen to that keenly. Always take responsibility, because when you blame, you give away your power. And when you give somebody your power, you've allowed them to control you. Okay, so you've taken their identity. Now they can use that identity to control you. Don't ever give out your power. So take responsibility. If you make a mistake, take responsibility and rectify it. Number five, believe in yourself, believe in your dreams, because if you don't, we don't care. Nobody cares about your dreams. Number six, strive every day to become a little bit better than you were yesterday. Strive every day to become a little bit better than you were yesterday. Don't let anybody steal your dreams. They are your life's greatest treasures. Be part of solutions and not be the problem. Always strive to be part of the solutions, and always know that most people occupy space. Most people are not here to change lives. Most people occupy space, and that is a mess. Do what you fear most, because when you do it, you overcome. Do what you fear most, because when you do it, you overcome. And then constantly seek advice from people that have more experience, more knowledge, and more success than you. It will speed up your journey to success tremendously. The next one is don't focus on the past. It does not equal your future. However, no one amongst us has a future, because that's something that is actually in our heads. There's nobody who is assured of a future. So there's no future. Your future is your present. So do everything in your present, so that if God gives you the grace to live tomorrow, you don't regret today. Okay? So no one says this. Don't focus on your past. It doesn't equal your future. Don't focus on your future, because nobody has a future. Periodically focus on the present, because your future is your present. Next, choose to believe. The word is choose. Choose to believe that you have the power to change anything for the better. Choices. And then complain less and take more action. But above all, forgive and let go. Because when you forgive, you liberate a lot of energy and creativity. So forgive and let go, and then stand for yourself and what you believe in. I think I rest my case.
Well, thank you so much, Doc. Thank you so much. A round of applause again. Huh?
Thank you.
I think up to this point, we have to say that he has delivered on what we expected. And to everyone who is part of the personal development workshop, I think already you've gotten value for what you actually paid for and the time that you were looking for. Dr. Lewis has delivered today. All I can say is thank you for being part of this, Doc. And to everyone who's been part of this, a round of applause. Jipigieni Makofi. That's very good. We have a recorded version of this particular session. I just want to say that take care of your health. Your health is your business. Please take care of it. So I've shared the links to Dr. Lewis's Telegram channel in my Telegram channel, and also in my WhatsApp groups. So you can actually get the Telegram channel over there, join it, get more information. Over and above, ladies and gentlemen, I think already you have more information than you ever need when it comes to your health. I'm actually getting very, very nice messages from people over here. When you want to niambia, this was a good session, this was an amazing session. I personally want to say that I'll strive to make sure that every month we have a session with Dr. Lewis to talk about personal health. We'll talk about diabetes. We'll talk about anything that is health related. We'll talk about going to the gym. So in every session, like for those guys who are actually going to be a part of the graphic design bootcamp, every month, every single month, we're actually going to be having a session. Again, I'll also try and have Dr. Lewis for one of our physical networking sessions, where he's actually going to be talking about personal health. So basically, stay tuned and stay around. For me, this one was a really amazing session, and thank you to everyone for being part of this. All I can say is have yourselves a
Good night.
night. We'll have more of these sessions. Thank you so much, Doc. Asante sana.
All right, you have a good night.
Yeah, have a good night. Thank you, everyone, and have yourselves a good night.
Good night. Good night.
Thank you so much.
Thank you. Thank you, dear. Thank you, Elvis.